Hi, this is Francesco Rulli. I'm the CEO of Querlo, and I'm here today with Eric Eskiog, who is a neurosurgeon and also the Chief Medical Officer of Novant Health. So, Eric, if you can educate us a little further about your responsibility in this organization.
Yeah, absolutely. Good morning, Francesco. Thanks for having me on your show. I work at Novant Health. We are a 15 hospital and over 670 ambulatory care site, multi-state integrated healthcare system in the Carolinas and Virginia. And I have the privilege of being the Executive Vice President and Chief Medical Officer for the entire system, responsible for safety and quality, as well as all the physician affairs.
Thank you, Eric. So in the last few months, we have been talking and you have been very inspiring to me about your perspective. I would like to ask you, also specifically because of your experience, what are your thoughts about the COVID and possibly the post-COVID era? What are the challenges, but also the opportunities that lays ahead to us?
Yeah, we were not, like everybody else, this came out of nowhere. We were not anticipating it. And we're still in the first wave of COVID. Make no mistake, we have not gotten over the first wave as a nation, and we continue to deal with it. The nice thing is we've been able to gain a lot of experience taking care of COVID patients. So now we're at a stage where we can safely, at our healthcare system, take care of COVID patients alongside non-COVID patients that also require life-threatening interventions or health maintenance. COVID has definitely upended our system, but the silver lining has been that it's accelerated some of the technologies that would have taken another 5 to 10 years to get there. Some of the interesting aspects is televisits. We've all heard about it. Our system, as a system, we're doing about 150 e-visits a year on the ambulatory site. And at some points during COVID, we were doing over 7,000 electronic visits, televisits a day. So this is going to accelerate. And moving forward, COVID is going to offer us the opportunity to be able to provide touchless care. We're working on touchless care as much as possible. We can take care of the patients remotely without touching them, with remote patient monitoring devices, with a lot of data coming in, streaming in. And if you look at the space exploration, this is going to be important when we start colonizing Moon, and eventually in the next 30 years, probably 20 to 30 years, Mars. We're going to have virtual healthcares and virtual hospital systems to take care of these first colonies that form initially on the Moon and next in Mars. So this is a concept we have to perfect on Earth. And unfortunately, COVID-19, as bad as it's been, it's giving us that opportunity to do that.
Okay, very interesting. Thank you. Now, what are your thoughts about the role of artificial intelligence in this new reality? What have you seen? There have been the changes that will eventually where AI can be actually of help for this new world.
Yeah, thanks for bringing that up. As you know, I'm a big proponent of artificial intelligence, really try to drive that home at our healthcare system. I believe this is going to put artificial intelligence on a much faster track than we have been able to adopt. A couple of the challenges is going to be financial, because as you know, healthcare systems are suffering financially because of COVID-19. But I think this is going to start making that artificial intelligence component reality. We at Novant Health actually develop predictive algorithms for our patients. We've developed dashboards where we can track our patients on any given time and updates hourly, looking at our supplies on a dashboard. So we have been heavily dependent on data to gauge our response. And even within 100 miles of our hospitals, we've had different peaks and valleys for COVID-19, and we've been able to shift our resources depending on where we need them the most. AI is not going to, the biggest concern from physicians is, am I going to lose my job if AI takes over? Well, first of all, AI is never going to take over. AI is going to be an assisted intelligence to you. And physicians who embrace AI will put physicians who don't embrace AI out of business, because AI is going to make him much more effective, much more efficient, and be able to communicate with the patients in a bigger way. So lots of great things coming up. I see a big consolidation in the AI healthcare space. You know, before COVID-19 started, there was a lot of smaller companies and niche companies But I believe that what's going to happen is you're going to see a big amount of consolidation over the next year or two, and then bigger winners are going to emerge in the AI space. They're going to dominate the healthcare landscape. We are partnering with a lot of systems, with a lot of companies, and it looks very, very promising.
Thank you. Very interesting. And if people want to learn more about Novant Health and your work in terms of innovation, what's the best way to learn or to reach out to you?
Absolutely. One way is to obviously go to our website. It's www.novanthealth.org, so you can see all the great things that we're doing. Also, feel free to link to me on LinkedIn. Be happy to email, answer emails, show you what we have done with Power BI and Microsoft Teams and our data analytics capabilities. And again, the name is Eric, E-R-I-C. Last name is E as in Edward, S as in Sam, K-I-O-G-L-U. And thank you for having me on, Francesco. Really appreciate it.
Thank you. Very appreciated. Thank you.